Good day everyone, I am Crisanta Natswasito, BSN 2K from Iloilo Doctors College. So today I am going to assist in nasogastric tube insertion and as well as assisting in nasogastric tube feeding. Step 1 is we're going to introduce ourselves to the client and then we're going to verify our client. Once we verified our client, the next thing we're going to do is we're going to explain to the client what are we going to do to them and then how they can cooperate and why it is necessary. So sir, I am your nursing student for today. I am Chris Antonatsusito. May I know your name, sir? Okay, Sir Kim. Today I am going to insert you a nasogastric tube, sir. So upon inserting the nasogastric tube, it will go into your nose and going down to your stomach, sir. So it is necessary for your feeding as well as for your medications. So we are doing this because you still cannot eat through your mouth. So you can cooperate, sir, by following my instructions and as well as answering my questions during the procedure. Will that be okay, sir? Okay, thank you. Step 2 is we're going to assist our client in a high Fowler's position. So sir, I'm going to assist you in high Fowler's position, sir, ha? Step 3 is we're going to provide privacy to our client. Step 4 is we're going to perform hand hygiene before the procedure. Step 5 is we're going to assess the client's nerves. So we're going to check which nerve has the greater airflow. So in that part of the nerves is we're going to insert our nasogastric tube. So sir, I'm going to ask you to breathe into your nose. So I'm going to include your one nerve and you're going to breathe on the other side of your nerve. Will that be okay, sir? Okay, thank you. So the right part of the nerve of our client or nostril has the greater airflow. So in that part of the nostril of our client is we're going to insert the nasogastric tube. Step 6 is we're going to prepare our tube now. So upon preparing, we are going to determine how far the tube can go to the client's stomach. So this is our tube. This is French 18 because our client is adult. We are assuming that our client is adult. Step 7 is we're going to determine how far the tube can go to the client's stomach. And we also have here our tape so we can mark which part of the tube is we're going to stop inserting the tube. So upon determining how far the tube can go to the stomach of our client is first we're going to put the tip of the tube into the nose tip of our client. So sir, I'm going to determine how far the tube can go into your stomach, sir, ha? So first is we're going to put the tip of the tube into the tip of the nose of our client and then go into the earlobe. And then next to the xiphoid process. So since our tube has already a marking, it says 156 cm. If our tube doesn't have any markings, we're going to use our tape. So upon inserting the tube, we are going to put on our gloves So, upon insertion of the nasogastric tube into the nose of our client, we have here our kidney basin, our adhesive tape, our alcohol pad if the nose of our client is oily, our water-soluble lubricant, and as well as our nasogastric tube. Now is we're going to lubricate our tube. As you can see, our tube has its natural curve, so that is the one that we're going to insert into the nose of our client. So we marked at 150 cm, and now we're going to lubricate it. Once we're done lubricating our tube, we're going to insert the tube into its natural curve. So this is the natural curve of our nasogastric tube. We're going to insert now the natural curve of the nasogastric tube into our selected nostril. So our selected nostril is the right part of the nose of our client. And then upon inserting, we're going to ask our client to hyperextend its head. So he's going to do this, hyperextending upon inserting our nasogastric tube. So sir, can I ask you to hyperextend your head, sir? Because I will going to insert the tube now. Will that be okay, sir? Okay. Our client has already hyperextended his head, and we're going to insert now our tubing. We're going now to advance the tube into the nasopharynx of our client. Now we are going to insert the tube into the nostril of our client, going to the nasopharynx. Sir, I'm going to insert now, sir, ha? So upon inserting, sometimes the client may have a weary eyes, and then we're going to provide tissue in case. Sir, I'm going to insert na, sir. Assuming that we are already inserting the tube, so once we are already at the nasopharynx of our client or the throat of our client, we're going to ask our client to sip a water or swallow so that our client may be able to help us inserting the tube. So sir, can I ask you to swallow, sir? And we are going to assume that our client is drinking water. So upon this procedure, our client sometimes may gag, and if our client may have a gag reflex, we're going to stop momentarily, and then we're going to ask our client to take a rest and then take a few breaths. And then next is we're going to continue our procedure. This is the sir now. Are you comfortable, sir? So we already at the 150 cm, so we're going to stop now. So once our tube is already at 150 cm, we're going to check now the stomach contents of our client, if we are on the right spot or on the right place, or our tubing is on the right place on the stomach of our client. So we are going to use pH test strip to check the stomach contents of our client. So I am going to aspirate stomach contents using a septum syringe. And as well as I have a small container here where I can pour the gastric contents together with my pH test strip. So we're going to check now the stomach contents of our client. And then we're going to clamp our tubing. The next thing that we're going to do is we're going to pour our aspirated gastric or stomach contents into our pH test strip together with our small container. So once we check the stomach contents of our client and it indicated that we are on the right spot, the next thing that we're going to do is we're going to reinstill all the stomach contents that we aspirate, and we're going to reinstill it with the tubing. The next thing that we're going to do after we check that we on the right spot or we are already on the stomach of our client, the next thing that we're going to do is we're going to secure our tubing. So we have here our adhesive tape, and we are going to use a safety pin to pin the tubing into the client's gown. First is we're going to secure the tube into the nose bridge of our client. So we're going to cut the tape about 3 inch. And then we're going to turn it into half, about 2 inch. And then we're going to put it on the tip of the nose of our client. We are going to put the tape now on the nose bridge of our client. Sir, I'm going to put the tape, sir. So the split ends of our tape is we're going to roll it into the tube, or we're going to put it around the tube. Since the client's nose is not oily, we didn't use alcohol pads. Next is we're going to secure the tape into the gown of our client. Assuming that our client has a gown, we're going to put a tape at the tube. We're going to roll a tape at the tube. And then we're going to put a safety pin on our tape. And then we're going to pin it into the client's gown. Now we are done with our assisting in the nasogastric tube insertion. Next is we're going to proceed to the feeding. So before anything else, we're going to check the feeding, its expiration date, and as well as we're going to check if our feeding is on a warm temperature or in a room temperature. So the expiration date is February 12, 2024. And then we're going to check if our feeding is warm or in a room temp. Okay. So we have here our septo syringe, which is we're going to use the feeding. So we are going to remove the bulb of the septo syringe. And then, before putting the syringe to the tube, we're going to clamp it first. So we're going to clamp it. So upon clamping, we're just going to do this. Next is we're going to open the clamp and then we're going to put our syringe barrel. Next is we're going to prepare for the feeding. So we are going to put our feeding now into the barrel. So upon putting the feeding into the barrel, we're going to adjust the flow rate as needed. So we're just going to put the syringe or our barrel up, higher or lower to determine the flow rate of our feeding. So we also prepared a water about 50 to 100 ml so that we are going to pour it into the syringe before our medication or our feeding reaches this part of our syringe barrel. So we are going to put our feeding now. So before our feeding has reached this part of our barrel, we're going to pour about 50 to 100 ml of water. So this is our water, about 80 ml. So before the water could reach this part of our syringe, we're going to clamp it again, or we are going to clamp our tubing again. And then the next thing that we're going to do is we're going to remove our syringe barrel. And then we're going to clamp our tubing. The next thing that we're going to do is we are going to secure our client's comfort and safety. So we're going to ask our client to remain in a high powers position about 30 minutes. Next is we're going to check the agency's policy upon exchanging or changing our nasogastric tube. Next is we're going to dispose of the equipments that we use. So if our equipment is needed to be reused, we're going to wash it with soap and water so that it will ready for reusal. And then we're going to change all the equipments every 24 hours according to the agency policy. The last thing that we're going to do is we're going to document all relevant findings, including our feeding, the amount, and the kind of solution taken, and as well as the duration and assessment of the client. And then we're going to record the volume of the feeding and the water instilled into our client. And then we're going to check the client's intake and output. And lastly is we're going to monitor the client's possible complications upon our feeding and our nasogastric tube insertion. So to prevent dehydration, we're going to give our client a supplemental water in addition to the prescribed tube feeding as ordered.